Why do I know my package just left the warehouse? That's like more information than I need to know, but I don't even know where my loved one is on the way to surgery.
Oh, welcome to the Patient Experience Strategist interview series. I'm Ebony Langston, and today I am joined by Rick Evans, Senior Vice President and Chief Experience Officer at New York Presbyterian Hospital.
Ebony, it's so good to be with you. Thanks for inviting me. So, as you mentioned, I'm the Chief Experience Officer at New York Presbyterian, which is a actually pretty large system in and around the greater New York area, 11 hospitals, 55,000 employees, 700 outpatient areas. So it's quite an adventure trying to make patient experience work across that entire
Yeah.
continuum. My healthcare career started in 1997, so approaching 30 years in healthcare, and almost from the very beginning, patient experience was something that I worked on.
You shared a story about kind of feeling like the sky was always falling when you first entered into healthcare. What does it take, you think, to stay in this work for all the years? What does it require? And how has the field kind of evolved over the years?
What's evolved a great deal, but the story you're referencing, one of my early mentors in healthcare, I can remember when I first started, I just looked around. I thought, God, this system is so not aligned. It's sort of screwed up. It doesn't make sense. And he said to me, basically, you got to get used to that, my friend. If you want to work in healthcare, it's a system that is dysfunctional in many ways. You've got to decide whether you want to work in that environment. And what that left me with at that time was I started getting less stressed out by the fact that the system is sort of misaligned and really focused on how to make it better. And I think that's what all of us have to do to make that shift to say healthcare is tough, challenging. That's the work we do every day, is to try to make a system that's not optimal work as good as it can for the people who are coming for healthcare every single day. So that to me is what you have to do. You have to acknowledge that there are real challenges and that there's some things that don't sort of make sense. And you commit yourself to trying to bridge that for everybody.
Yeah. And you just said something here about everyone's role. And the CEO at Commonwealth has a great quote where he talked to his staff, from the janitor to the cooks to the actual patient experience staff, have a role in the health outcomes of the patient. I had a few conversations also in the hallway at the Congress with some folks who were not necessarily in the patient experience departments, just kind of coming to a realization about how much revenue was actually tied to the experience. You shared a story where you was talking with a finance leader who didn't quite make that connection. Can you take some time to talk a little bit more about, how do you translate this work to other executives to help them understand how it applies to them?
So the good news is that over the last 30 years, there really is a body of knowledge and a domain of expertise in patient experience. We've been looking at data from patients and families for decades. There are very clear signals about what they want to see be done better. Most of that is around communication. And then there's been a lot of work on what interventions and best practices should be implemented to address the gaps that our patients are telling us about. So it's not a mystery anymore like it was when my first boss gave me a data report. We know a lot about what that data means, and there's actual evidence-based interventions now out there that when you implement them consistently, you move the needle on patient ratings. Now, to the question that you're asking me, everybody has a role to play, right? And we often think of the doctors and nurses with patient experience and how important they are, but most of us who work in hospitals walk through them every day, right? So I talk a lot about something we call citizenship. If you work in healthcare, then there are opportunities for all of us to make healthcare more hospitable, more human for everyone. Most of our employees are coming in as commuters, right? So what do you need to do to survive the subway ride? You put your earbuds in
Yeah.
and you try not to touch anyone, and you get through the chaos. But when you're approaching the hospital, you're now entering a different environment. the earbuds should come out. Why? Because
Mm-hmm.
you're walking amidst our patients and families. So you may be a finance person, you may be a corporate person. There's an opportunity to help people find their way. There's an opportunity to pick up garbage and keep the place looking professional
Mm-hmm.
and clean. There's the opportunity when you're in a crowded elevator to help people get on board and not just take the space because you got to get to your meeting, but to say, there are people here, I'm going to make sure that they get to their appointment. There's
Mm-hmm.
stuff that all of us can do to make our places more human and more welcoming. And we call that citizenship. We have best practices for nurses or doctors, but there's something all of us can do, and everybody should be aware of that.
Oh, I love that. Such a simple thing. Just take the earbuds out and let people know you're available. You're here. You're aware. So, how do you think systems should approach their AI strategy, particularly in incorporating the voice of the patient?
I would say two things. One, that AI is coming upon us so rapidly. I really have had to up my game understanding what AI is and when it can be
Uh,
used, when it shouldn't be used. So it's changing every single day. Every organization should have robust governance of AI. Threshold things like safely using AI. AI hallucinates, right? So you can't rely on it for clinical things. Or if we do,
uh,
we're curating it very, very thoughtfully. Patient privacy and maintaining confidentiality, those things are all need to be thought about. We've got to make sure we're governing its use in a very thoughtful way. We need to embrace it though. So how do you walk that fine line between using it properly and not violating the trust and safety of the people we're caring for? I would add another question to it. If just because we could do something, should we be doing it? So
uh,
for me, you need that safety lens, but you also need a values and ethics lens. How can AI be used to enhance the humanity of healthcare?
uh,
Danger is that healthcare becomes just a series of transactions. That would be a tragedy. But healthcare is about more than just transactions, right? And AI can be deployed in a way that allows our nurses or doctors to operate at the top of their skill set. There's a real plus there. Imagine if AI really could take away some of the technical pieces of work, free up time for a clinician to actually connect as a human to their patient.
uh,
So there's real potential, but it has to be very carefully thought through, curated, and we should always be asking ourselves, how is this use case for AI either going to make it easier for people to get what they need in a safe and compliant way?
I always walk through people when thinking about AI. I put it in three categories. It has the ability to automate, augment, or amplify, right?
Love
Automated,
that.
like you said, those like routine tasks that make sense that AI can do very easily, quickly.
Mhm.
Augmenting, to your point, this is where like the stuff like ambient listening helps to augment that human connection there. And then amplifying is where you start to be able to take advantage of things like data analysis and population and risk stratification. And it's really starting to personalize the experience, but never should the human be taken out of it.
And you reminded me of something that we're doing at NYP that amazed me when I first heard it. It can allow us to really make some advances in actual clinical care. In our organization, we have millions of EKG strips, the data of the strips. We use AI to look at those, and AI can more accurately describe and predict structural heart disease. So you may be able to tell someone that they had a structural heart issue years before they would have found out otherwise. That's life changing for those patients.
You posed a question in the room around how many systems had the ability for their patients to schedule appointments online. And there were so few hands raised across the room. That's where a lot of my work focuses is on the work and the experience outside of that. Where would you say is the single most consequential piece outside of the actual care delivery moment?
Unfortunately, there's a lot of opportunity. We've moved from thinking about patient experience. I mean, there was a time where if you dared suggest we call a patient a customer, people would like clutch their chest and say, how could you do that? You know what? I have no problem with that. There are times when we are patients on an exam table in a procedural, and there are a whole set of expectations that should be met in those periods. That's patient experience. There are many times when we're seeking care as customers. We're trying to make an appointment, pay a bill, get a prescription refilled. Healthcare does need to be able to enable transactions when those are needed. We are terrible at it as an industry. Terrible. I mean, Delta Airlines does it way better. Amazon. I mean,
Mm-hmm.
and again, we shouldn't be reticent about comparing our ability to those experiences because people are coming to us saying, why can I get this in Amazon and I can't get it at the hospital? The expectations are there, and we need to do better at meeting them. In my organization, we are doing an enormous amount of work to make sure that customers can interact with us at the time of their choosing. If you can think about making a doctor's appointment at 10 p.m. at night, you should be able to schedule things when it's convenient for you. Sometimes you just want to go online and make an appointment. Sometimes you want to talk to a live human being, and you should be able to call and get an
Mm-hmm.
answer, not a
Mm-hmm.
voicemail.
Yeah. Yeah. Are there, what do you think are some of the challenges behind catching up to where some of the other industries are?
A lot of it is culture.
Mm-hmm.
So we have the technology. If you want to enable online appointment scheduling, the guts underneath that are literally doctor schedules. They're what we call their templates, right?
Mm-hmm.
So the appointments in many, many organizations, the templates for physicians are the Wild West. They're all different. Delta
Yeah.
Airlines has their flight schedule. There's
Uh-huh.
one flight schedule, right? Healthcare's a little more complicated than scheduling flights, but you have to go into the details of those appointments and try to align them. Can we make it in a more uniform structure so that we can expose the appropriate appointments to patients for them to make their selections? I just described it in 2 minutes. It's enormous work, and it is more culture change than it is technology. It's really challenging. I would say most of my access work is culture and change management more than the technology piece. You've got to treat your doctors with compassion, just like you want to treat your patients. Where can
Mm-hmm.
we structure things in a way that work for patients that also feel good for the doctors? There's this thing called pajama time, which is I'm a doctor, I'm seeing patients all day long. And then I got to go home at night in my pajamas and do all the charting that I didn't get to do during the day. Can you deploy ambient listening so that pajama time gets reduced? Can you say to a doctor, our patients want weekend hours? There may be some doctors in our organization that would love to work weekends because it works for their life. There's some that would
Mm-hmm.
gladly work into the evenings to give patient evening hours if they could adjust their schedule in other ways. It's more of an art than a science. It's finding that sweet spot that works best for the doctors, but that also allows us to uniformly, reliably present appointment options to patients so that they can schedule themselves.
So one last question for you, Rick. As people who are coming into patient experience industry or roles, what do you think they underestimate? What's the biggest challenge, or where do they need help that they don't yet realize?
I think the biggest challenge in patient experience is two things. One, everybody salutes the flag that we have to have a good patient experience, but often it gets shortchanged. And that's because I don't think it's widely understood. A lot of people in leadership positions think PX means just be nicer. If only it were that simple. There are real communication gaps that are endemic in healthcare that need to be. So one of the challenges is keeping it as a true priority on your organization's agenda. And priority means funding too. If it belongs to everyone, it belongs to no one.
Mm-hmm.
If the patient experience role isn't in an organization in a way that has strategic alignment, then it gets shortchanged. Then the other piece that's hard is most patient experience teams or structures are very small, small but mighty. We're in the business of influence. A key competency in patient experience leadership is being able to understand how to lead and influence people when they don't directly report to you. It's a skill set that
Mm-hmm.
takes time to figure out. How do you
Mm-hmm.
own what you know, bring it into the room, get people to pay attention to that, get it aligned? How do you convince people that are very, very busy a busy nurse, a busy doctor, a busy transporter, a busy housekeeper to do something a little differently in their workflow, that requires a skill set allows you to influence. You have to show people you understand their reality. You have to be able to understand the workflow and why something getting inserted into that will actually make a difference. So there's a skill set that's very unique in the patient experience realm. Now, the good news is there are resources out there for people to learn about that, but it's a little different than other leadership positions in healthcare.
Yeah, for sure, for sure. Well, Rick, thank you so much for your time and the conversation.
Well, I appreciate your invitation. I hope it was helpful, and thanks for giving me the opportunity to talk with you.